So Women Leaders in Elder World is made up of Patricia Dubrow from Assisting Hands, Ellen Tillman from Ellen Tillman and Company, Corliss Woods from Clutter Corrections by Corliss, and Exit Right Realtor, Jessica Parker from Adult Speech and Therapy Service, Meryl Schaefer from TLC Daily Money Mentor, and Pamela Mills, Enriching Connections Concierge Report. And the last but not least is Cynthia Ward from Only Assisted Living. We've had the opportunity to meet everybody on the team this month, and so far, well, you're going to meet Patricia tomorrow, or Ellen tomorrow, and Patricia next week, but Cynthia with Only Assisted Living has not been on yet. And I just want to give a shout out for Only Assisted Living. If you're in Montgomery County, if you've got a client that needs memory care, Only Assisted Living is an exclusive memory care option that you should definitely investigate for your clients and your loved ones. And then another little commercial here. We are working on the next version of the Virginia Hospital Center Senior Resource Guide. And this is something that only comes out every 18 months. And I tell you, if you were on our call last week with the case management department at Virginia Hospital Center, you know how important having a resource in a hospital can be to help families make a decision. And this is one way that you can sort of ride into Virginia Hospital Center with your branding 24/7 for 18 months. I'm really excited. The new DC edition of Sourcebook, it will be out next week. We got it at the printers. We got a bunch of really cool stuff that's going to be in that issue. And a lot of them are brought over from these digital discussions. Got a age of coronavirus section. We're addressing ageism, inclusiveness in senior living. We got a feature from Matt Paxton. And what I think is really cool is that the community of providers is really important. And we've got a complete list of every aging life care managers in the DC area with a partnership with Aging Life Care Association, got a partnership with Grows, a networking group, and we got their membership directory, and we got the new provider yearbook in there. So it's some new features that I think you guys are going to really like. Whew, okay, so with that, we are ready to bring on our featured panelists today, and that is Dr. Maggie Gloria and Lindsay Hutter from Goodwin House. Welcome.
Thank you, Steve. Pleasure to be here.
Yeah, it's great to have you guys, and I'm really excited about our discussion today. And you know, one of the things I know we all wish that we could have face-to-face meetings still, and we will soon, but I guarantee you when we start having face-to-face meetings, and this goes on forever, we're gonna have a camera there too. So if you can't make it to the meeting, you're gonna jump on Zoom. But one of the things that I really like about this new platform is how quickly we can bring an idea to the table, share it with the audience, and get feedback and make things happen. And this couldn't be illustrated more with this topic today, because I want to say it was a couple of weeks ago, Lindsay reached out and told me what they were doing with this COVID playbook. And I was just like, wow, let's bring this to the audience. Let's have a discussion around this and share this resource. And so, you know, just like that, we're able to kind of bring it to the table. So, but before we jump into the topic, let's get to know the two of you a little bit better. Lindsay, I'll start with you because I've known you for a while, and tell us a little bit about you, what you do at Goodwin House, your background, and how you came to the position that you're in.
Sure. Well, Steve, first I want to say thank you, because you continue to be one of the most serving souls for aging services, and you live the word pivot, which is what we've all had to do a lot of during the pandemic. And you've pivoted to this fantastic virtual programming and networking. So thank you. And big congratulations for the well-deserved honor from Insight Memory Care Center. And I'm thrilled for you and thankful that they had a great event last week. And so again, congratulations and thank you, Steve.
All right, I'm blushing. Yeah.
You're blushing. So
Okay.
my background, Lindsay Hutter, my role is Chief Strategy and Marketing Officer with Goodwin House Incorporated. And we are a senior living and healthcare services organization. We serve 2,000 older adults across Northern Virginia, some of them in our communities, some of them in their homes, some of them in other senior living communities where we're bringing in home health, hospice, and other services. And my experience, actually, the doorway to get to Goodwin House was not a career in the healthcare field or the senior living field. Rather, I was a global consultant and I was invited to serve on the board for Goodwin House at Home, which is one of about 36 continuing care at home organizations that Goodwin House launched in 2014. And it was during that service that this new role, CSMO, was created, and board members asked me if I would even think about it. And 3.5 years ago, I began my service to Goodwin House Incorporated. Pleasure to be here.
Great. All right. And now, one thing I've learned about our next panel member is in the promotion, I have her as Dr. Margaret Gloria, but she prefers to be called Maggie. So Dr. Gloria or Maggie, tell us a little bit about what you do at Goodwin House, what got you there, your background.
Thanks, Steve. So I'm an internal medicine specialist. I did both my internal medicine training and my training for hospice and palliative medicine at George Washington University Hospital. I was there for a couple of years as an attending physician, and I actually joined Goodwin House a little less than 2 years ago as the medical director for the hospice and palliative team. And I've been lucky to be a part of the leadership team on the infection prevention precaution team since the start of the pandemic.
Great. All right. Well, okay, we got to know you. Now let's dive in a little bit to the project that you guys have embarked on. And I've got your PowerPoint up on my screen there, Lindsay. So you just tell me where to go and what to do. And then what I would also just remind the audience of is that at any point in time, if you've got a question or a comment, just type it into the Q&A box. And we can jump into that and address those as well. So Lindsay and Maggie, take it away.
Wonderful. Thank you so much, Steve. So the title of this brief slide deck captures the complete spirit, mission, and intent of our COVID-19 playbook, Together Stronger. We had some conversations with different organizations in Northern Virginia and quite a few in Alexandria in August. And we realized that they were scratching their heads and saying, okay, can our churches reopen for in-person services? Can our schools, can our before and after school programming, can our small businesses reopen? How do we go about this? And we stood back and we said, oh my gosh, we've got a playbook. And it's a playbook that we, like many other senior living, home care, healthcare system organizations have developed, was born out of the pandemic. So we've been on the front line. And is there a way that we could take the practices, the tools, the templates, the protocols, the lab relationships, testing lab relationships that we've developed and put them into a playbook that any type of organization could review and customize to their own situation? So it's completely born out of community accountability and community service. And that's really important because it's part of the Goodwin House mission. So it's very consistent with who we are as an organization. There's also another benefit to us to share this playbook with the businesses that are around our life plan communities and around where our employees live and work. And that's if they reopen and resume activities more safely. That keeps the positivity rate low. And the positivity rate is a trigger for testing that is required by the local municipalities for senior living organizations. So when the positivity rate goes above 5, when it goes above 10%, when it goes to 15%, that has a dramatic impact on a senior living organization because our staff members, as they're going to the grocery store, as they're living their lives, they could gain exposure and that would bring it into our communities. So whatever we can do to be stronger and safer together benefits all of us. So let's talk about what actually is the playbook. And I'm going to cue you for a slide in just a minute, Steve, to proceed. But the playbook is a compendium of resources. It's very action oriented, and it's very light on Goodwin House branding, because we didn't want to impose our brand, and we didn't want to impose our business operational model on other businesses. So we stripped out the Goodwin House branding to create genuine generic templates that any business could adapt. And we also reviewed our protocols and our templates and said, if we were to rewrite this in a way that any type of organization, a school, a church, a trade association could adopt, what would it look like? So for those of us that are in senior living, when you walk through the playbook, you may say, well, gosh, I'm surprised they don't have this or they don't have that. Again, we were going a little bit light on the senior living component because we presumed that a lot of our peer set were already doing much of what we were doing. So let me flip to the next slide, because that's going to give you a view of what we've learned, what we've developed, and therefore what we've put into the playbook. We began our infection precaution and planning effort actually in February. Our IPP team, infection precaution and planning, started meeting daily on March 2nd. Dr. Gloria and I both serve on the IPP team. And that was a month of establishing protocols, putting up training systems on the new protocols, and as much as anything, becoming a news engine with communications. We were communicating daily with our residents. We were communicating daily with our staff. And the regulations and the guidance was sometimes changing twice a day. So that news engine component was really real. In April, go to the other month, I've got something happened with the March, April, May, and I apologize for that on the screen, but look at the middle image, which is the employee in the mask. And that's the month of April. And in the month of April, we, like many others, were trying to obtain PPE. And Goodwin House said, we're not big enough to go on a global market and get the volume that will get the attention of global suppliers. So we actually developed a group buy program. Nearly 60 organizations around the region and around the Commonwealth participated in that. And to date, we have purchased 950,000 items of PPE. And it's been not only for Goodwin House, but for, as I said, now 60 different organizations across the region. We're continuing to do that. So we had a system set up for group buys that we've brought forward into the playbook. Then on the far right column, you see clearly what are some COVID tests being held up. We began establishing relationships with testing labs in April. And we were able to then proactively launch testing across our entire organization, which we continue to this day on a regular basis. Whether or not there is an outbreak, we have regular testing. And so we developed relationships with the testing labs. And that was another relationship access point that we could pull forward into the playbook and make available to other organizations once the testing labs had the capacity to contemplate that. And for our relationships, it was in August that we were able to start to have those conversations with them. So Steve, if you flip to the third slide, which says timeline priorities, July through August.
Yeah, and I opened up your slide deck in PowerPoint now. So I had it in Google Slides, which is why you had the
okay. So if we think about then what was happening in June, well, society was starting to reopen. States had their reopening plans moving in phases. So did we. We began to resume various amenities and activities on our campuses, our senior living communities. In July, we were able to continue to open up even more activities and resume different programs that we had, all the while continuing with our core infection precaution practices and our regular baseline testing. In August, we started resuming small group gatherings. And this is when we looked up and said, gosh, we've been through the whole cycle of reopening. We've established these systems, these protocols, these templates. What if we were able to package them and share them with more organizations? Before I go deeper into the playbook, I'm going to ask Steve to advance to the next slide because it shows you what our case report's been. And frankly, if anyone said, gosh, here's our playbook on how we've responded to the pandemic, I'd probably want to say, well, have you done a good job in responding to the pandemic? So what you see is our case report as of yesterday. And you see that we've had several dozen staff at both of our communities that have tested positive. And we as an organization have been very quick with the contact tracing, very quick with the quarantines and the protocols, as I'm sure you all have been. I would also share with you, sadly, that we have had 4 residents pass away due to complications with COVID. They were older, they were experiencing other health ailments, and then contracted the coronavirus and sadly did not survive that. So you're seeing on the top line what we've had with our 2 communities, Goodwin House Alexandria, or GHA for short, and Goodwin House Bailey's Crossroads, GHBC for short. In the lower table, what you're seeing are the home and community-based services that we have that go out into the region and serve older adults in their homes or in other senior living communities. So with our Goodwin House at Home, continuing care at home program, we've had no positive cases, members or staff. In our Goodwin House Hospice program, you see that we've served 40 patients that have tested positive as part of our hospice program. And these have not been in our communities, they've been in other senior living environments. And then our Goodwin House Home Health program has served 4 older adults that tested positive. Now, if you have any questions related to what's involved in serving hospice patients that test positive, Dr. Gloria will be a great person to ask those questions. She's really been point for our medical guidance and our precaution efforts with our hospice program. So that's the effort that we've had to date since the pandemic began. And now let's
Let me, I hate to interrupt you, but I want to sort of shine a spotlight for our audience on what we just heard here. There's 2 things that I think are really important. Transparency. I mean, Lindsay and Dr. Gloria, first off, thank you for sharing this. I know that, for a lot of people, it's sort of like, oh, we can't share our information on our COVID testing because we've had some positive tests. And it's sort of like, what I've seen from a big picture perspective is even if you have an influx of cases, it's sort of like you're better off sharing that and then also sort of sharing, here's what we did. These are our cases. This is what we did. And that gives your families and the community at large more confidence. 2 weeks ago, we had gosh, her name escapes me, but she runs hair salons in senior living communities. And she said, one of the worst things is for one of our stylists to overhear from the staff that somebody tested positive and it wasn't directly from the leadership and management team. And so I think you're representing how important transparency is. But I also think what you're representing is the review of what we all did as an organization in this COVID-19 crisis, whether the outcomes were what you wanted them to be or not. It's like doing that internal review and documenting it is super important. So just wanted to emphasize that. I think it's really, really pretty cool here. Okay, so I'll advance.
Steve, if you'll stay with that for a second, because we on the East Coast had the benefit, and I'm sorry for all of our peers in the field of senior living and healthcare on the West Coast, but we had the benefit of watching the headlines and seeing the broadcast news stories. And I was taking note because at that point, our infection precaution and planning team was up and running. And I watched these headlines and I said, I may not be able to prevent bad news, but we as an organization can make sure that the family members of our residents and our staff hear it from us first and not from the 6 o'clock news. And
That's
so
great.
we adopted a philosophy of we will be extremely transparent. And for anyone that wants to visit our website at goodwinhouse.org, you can click on the COVID page banner on the main landing page, and you will see the updates that we publish every week to our family and friends. You will see our protocols. You will see every communication. And we publish daily to our residents, and it's actually very visible, and it's sent out by email. It's posted. Here's our case count. If we get a new case, they're the first to hear about it.
Right.
So that transparency is key to credibility.
No, that's great. And before we jump off this slide, Terry Gross with Arden Courts had a question is, what is the difference between Goodwin House at Home and Goodwin House Home Health?
Right, and it's a great question. Thank you for raising it. So Goodwin House at Home is part of a small group, about 3 dozen in the country, of organizations that are continuing care at home programs. So if you think about the benefits of a life care community, and life care communities have that contract which you advance pay through your entrance fee to prepay and establish a level price, not a price that's going to escalate based on your cost of care needs, but to inoculate yourself from runaway care cost. And then you have all of the services provided to you of a life plan community. Take that model and apply it to an older adult who says, I want to age at home. And at some point, as I'm aging at home, I might need some additional care. We coordinate that care. We do that through third-party partners. So we're not actually a home care agency in that sense, but we're coordinating any of the care that individual may need. In addition, if there are needs around their house, we will help provide the coordination. We also help them make their house aging friendly. So it has a financial component, a care coordination component, and that's 24/7. Every Goodwin House at Home member has a member services facilitator that is 24/7, their one call for when things happen. So imagine this, and we've had this happen with Goodwin House at Home members. They fall walking the dog. They break both arms. They make one phone call. The dog is taken care of. Their house is taken care of. Someone meets them at the hospital, plans their return home and therapy needs they need in the home. Seamless. That's Goodwin House at Home. Goodwin House Home Health is a Medicare certified home health agency that is providing various therapy, nursing, and other services to older adults. And they service residents in our communities. They service older adults in their homes who maybe have had surgery and need to come home and have some support with home health. And they also are a provider to a variety of other senior living organizations around Northern Virginia.
Right. And then just before we kind of get off the Goodwin House at Home and people understanding your organization a little bit better, a comment came in. So it's a long-term care policy, Goodwin House at Home.
Yeah, that individual is wisely connecting the dots, that it is a long-term care like policy. So if older adults do need to move into assisted living or nursing care, the program pays the cost of those based on the membership level that individual joined.
Yeah, but unlike a long-term care policy that doesn't necessarily have the social component and the personal connection component,
Right.
You guys offer all that.
We offer all that. And in fact, during the pandemic, we set up grocery delivery and pharmacy delivery for our Goodwin House at Home members that lasted probably for about 2 months. Because at the very early stages of the pandemic, when it was a stay home order from the governor, they didn't want to get out, but yet they needed to get groceries. And so we set up a grocery order service through our life plan communities. And we developed a virtual programming, just as you did, Steve. We pivoted to help them with the isolation factor.
Awesome. All right. So let's dive in here.
All right. So we're transitioning. So pay it forward with the playbook. What you see on the left are a couple of bullet points about the playbook. It's that compilation of our protocols. And We didn't put all of our protocols in. I think we've adopted over 225 since the pandemic began, but the ones that would best apply to any type of business, we have tools, we have templates, we have sample letters and communications that if you have a positive staff case or if a customer or a business partner tests positive, all of that's in the playbook. We published version 1 in late August, and we've had several hundred downloads from not only our region, but now across the country. We've had downloads from senior living organizations, you might imagine home care organizations. We've had local health departments across the country download it, businesses, law firms, schools. It's just been quite extraordinary. We're now in development of V2. A lot's happened since August, so we've got 2 months, and we're going to be adding more checklists and more information on facilities and what organizations can do to really help keep their facilities safe. And then thirdly, just this morning, we talked through a section which will be how to gather safely as a family for the upcoming holidays. And what are some infection precaution tools that you can have around your home, and what are some practices that you ought to undertake?
You
The
know what?
What?
Yeah, I tell you what, it's funny that you bring that up, because I was thinking that topic right there would be a great discussion for us to have. So maybe we can schedule that where we dive into just that for a whole hour. Because as we move towards Thanksgiving here in a few weeks, it's sort of, I know a lot of family members are really nervous about what to do and how to do it. So wow, that's great. And just to reiterate, like, the cool thing about what Goodwin House is doing is this is a document that you could order and use and give it out as is, or you could just simply, they want you to sort of like get it, review it, and then, you can you can borrow their language, the copy, the setup, add to it, what have you. I think that's really a great mindset, and something that we should be doing, all of us should be doing with all of our materials here.
Steve, great question, or great encouragement for folks to reuse this. Senior living organization we respect greatly in Maryland contacted me last week, and I could tell that the person was a little bit sheepish about the question which was to come, and it was, is it really true, and is it okay that if we kind of adopted this and we put maybe our name on it and we send it out to other organizations, that would be okay? I said, please, absolutely do that. So if some of you that are on this webinar are looking at the playbook and you see it, you think, gosh, we can take this, we can literally pull off the pages, the material that's there, you can add some of your best practices and tools and send it out to your network, please do so. We're stronger together. So we're very genuine about that. And by the way, I should have said at the beginning, there is no compensation that Goodwin House receives for this other than knowing we're stronger together.
Cool. No, that's great.
So a little bit more about paying it forward on the next slide as Steve advances it. This one is, the reality of what we have learned with testing and lab access. And I know that we have some advanced questions that Steve will pose to Dr. Gloria about this, but you see a few photos showing the knowledge that we developed and the skill we developed in testing. And to date, we've done, I think, over 9,500 tests inside our organization since May. And prior to that, we'd never done a COVID test before. And now we're doing them weekly as part of our proactive testing. And so we realized we had a skill set, and we had some organizations locally which said, we are schools and we want to reopen because we serve a lot of underprivileged and single parents. And if they can't get back to work, they're going to have some real financial complications. So we want to get open. So we sent our nurses in to help do their first rounds of testing. So what you see really is paying it forward in terms of testing and lab access to these other organizations. And then the last slide that we'll show you, it's the final pay it forward. And this one is on PPE. The woman that's on the left in the photo is Lisa Wallace. She is our corporate director of supply chain. And Lisa is the one that came up with the phenomenal idea for group buy on PPE, which allowed us to go on the global markets. And next to Lisa Wallace is the Reverend Marcia Norfleet of the Alfred Street Baptist Church in Alexandria. It's a very renowned historically Black church. And we've developed a relationship with Reverend Norfleet and said, we look into fall and winter, and how are your seasoned saints? That's what they call their older congregants, which I love that term. How are they going to be safe and get PPE? And through that relationship, we were able to help Alfred Street Baptist Church obtain PPE for their seasoned saints. So, you know, Steve, it's all about paying it forward and being stronger together. And with that, Maggie and I would love to hear your questions and other questions from the audience.
Yeah, no, this is great. So guys, this is a great opportunity to type in any questions or comments or insights, or share what you've done in a similar vein in your organization, in terms of documenting and going through the COVID-19 challenges, but then, you know, creating a plan for the future. Let's make this just an open dialogue discussion. But this is for both of you, but I am curious, Dr. Gloria, on sort of like the medical testing, and like, what do you think is the single most important factor to keep older adults safe now and moving forward?
Yeah, I think that's a really hard question to answer because it's obviously going to be multifaceted, you know, the approach. But if I had to choose one single thing that I think is probably the most important, I think it would be testing. So easy, reliable, accessible testing, not just for the older adults, but, you know, for the community as a whole, so that we know that even all the people that are coming into contact, you know, with our older adults are safe and negative.
If you guys don't mind, because I think somebody's going to ask this question to begin with, and a couple of months ago, we did a sort of program where Noel would sort of walk through their testing protocol and kind of what they did. But what is the testing? What does it look like now at Goodwin House? Like, kind of how is that orchestrated? I think that on a high level, you don't need to get into the weeds.
So at the start of the pandemic, we kind of knew we were not immune. You know, we knew with roughly 2,000 people between our residents and our staff members, you know, in the buildings proper, we knew that we were going to have cases. And so we quickly realized that the best way to try and combat that would be to regularly screen people for COVID-19. And actually, you know, looking back at the slide of all those positive staff members that we had, the vast majority of those people were asymptomatic, actually. So we kind of implemented a program where, depending on the case positivity rate in our area, depending on the number of cases that we had actually had in each of those buildings and or in each of those areas, because we have, you know, all the levels of care, the assisted living, the skilled nursing, and independent living. So based on kind of all of those factors, we made a protocol for how often to test both the residents and the staff members. And that's changed as time has gone on, as positivity rates have changed, as outbreaks have happened. But I really credit any success that we've had with that regular screening.
That's great. And just out of curiosity, because I think one of the biggest challenges that we've got is our staff going in and out and interacting with their family when they leave and then come back in. What is the protocol that you guys employ for when a staff member tests positive? Like, what are the next steps when that happens?
Right. I don't know if do you want to take this, Lindsay, or do you want me to take this?
Yeah, I'll be glad. Oh, go ahead.
I can take it. Phil, you know, jump in if I miss anything. But so right now, our protocol is, you know, pretty immediately to stop, like Lindsay kind of alluded to earlier, communicate with everybody so that everyone is aware, you know, that we have a positive staff member. We start contact tracing immediately. That staff member goes home. And then any person that we know has had direct contact with that staff member is put on quarantine. And then we implement a testing protocol. So if it's, say on the assisted living floor, for example, that whole floor gets tested, and everybody is kind of on lockdown until we get the results back.
Okay, great. And then Brad Norris had a question. He
Steve,
says,
can I add one more thing?
sure.
And I think this is relevant to a lot of the organizations which have a very critical component of your operations, and that's your staff. So a couple of things. When a staff member is in quarantine because they've been exposed or they've tested positive, we actually have a whole care program where we're reaching out to them as they're at home. We're checking in on them. We're sending them letters and cards. We also have a shared PTO bank. So people that have built up a lot of PTO can turn in days to support when staff use more than what is our COVID gift for PTO days. So there are a lot of other components around supporting our colleagues when they either exposed or they tested positive and have to quarantine.
Great.
Yeah.
And let's see, Terry Gross has her hand raised, but Terry, just be on alert here, and I'll get to you here in a moment. But Brad Norris asks, can Dr. Gloria speak on cohorting residents in the skilled nursing facility during the COVID outbreak? And I'm assuming cohorting is referring to grouping people together who are positive. Could you guys share some of that?
Yeah, we actually had a protocol at Goodwin House to cohort positive residents. And I think it's a great idea. I think you have to think about a lot of aspects. And one aspect being some of the tests that are available now, the antigen test is something that comes to mind. There can be false positives. So be very careful about cohorting people together and just know that that person is positive. So if it were me personally and I were making that decision, I would wait to put somebody into a COVID-19 cohort until I had a PCR test back, if you're using the antigen machines, for example. And then just thinking about all the other things. So if you have a COVID unit, if you will, it's kind of something that we had done at Goodwin House, making sure that you're thinking about the ventilation. Does your staff have proper PPE? Is everybody trained to use the PPE properly, which is huge? I saw in the community, some of the other facilities had put up temporary barriers, floor to ceiling, which were really, really great. So kind of thinking about those kinds of things, what resources are available to make sure that you're safely cohorting people.
Great, thank you. And Terry, can you hear me? Terry? Terry. Oh, okay. I guess Terry is not on here. So Terry, if you end up coming on, just interrupt me. But got another question. You had referenced that other organizations outside of the senior living world are using the playbook. What are some of those organizations?
Yes, so we have in Alexandria, there's Grace Episcopal School, the Campagna Center, some other Episcopal schools that are part of the Episcopal school system. We have had the National Geospace Association, and they were one of the first to download it. The Arlington Department of Health has downloaded it. So you start to see that it's really just a wide swatch of organizations. We've had law firms download it. So when we look at the list, and the reason we have a download feature on the website is so we can just capture that information, not because we're going to use it for any marketing purposes, but we do want to let those that have downloaded V1 know that V2 is coming. What we've started to see are more office environment organizations download it, such as law firms who have been teleworking mostly through the pandemic, but are starting to say, well, what are our plans in the new year to go back into the office? And there's a whole section in the playbook which talks about how do you prepare your facilities? How do you prepare your protocols? How do you prepare your people for going back into an office environment?
No, and I love whenever a senior living organization can get its tentacles into the mainstream population and make people sort of less apprehensive and more like realizing what a resource that we provide. Like, what better place to get information on how to open your office than the segment of that has been hit the hardest and is under the most scrutiny in our culture. And so this is fantastic. So I think that's great. So I've got a couple of other questions.
Steve,
Yep.
before you jump to the questions that Kenneth and then an anonymous one came in, I want to point out another benefit of this playbook is those headlines that I talked about at the very beginning on the West Coast. Well, they moved east, and we have a strong public relations effort. And so we've been keeping ourselves and our board updated on the reputation of the industry and the impact of the media coverage. Our experience has been that state level media and local media tend to be less inflammatory and tell more of the positive stories, but the national media has told largely negative stories. And it's really done a number on the reputation of this industry. And so we felt that the playbook was also an opportunity to pivot from being seen as the problem to being seen as part of the solution.
Great. Okay. Terry Gross, who raised her hand, she was fortunate to be able to type in her question. And she's asking, if your residents go outside of the community, is it true that they have to self-quarantine for 14 days when they come home, even if they've only gone out for an hour or two?
Good question. And we actually started allowing residents to go outside under very limited conditions off our campuses, I should say. They could always go outside, but off the campuses in June. And we have slowly, as we've been able to put more precaution tools and testing in place, been able to open that up. And so there is a schedule, it's a one-page schedule. And it says if you want to go to the grocery store, the drugstore, if you want to pick up, carry out from a restaurant, that's fine. You can do that. You can go to doctor's appointments. If you're going to get on an airplane and then return to this community, then you're going to have a protocol where you are going to isolate in your apartment for a period of time. If you're going to travel outside the country, then there's a quarantine period. So it's a schedule of what is permissible with no quarantine, and then what's permissible with an escalating set of precautions. We, at the very beginning of introducing our Safe Path Forward plan, which is what we call our Safe Path Forward, our way by which we begin to resume some activities in community life, that it was going to be more like the light switches which dim and brighten slowly, that we weren't going to be a one or the other all flip. And that as the positivity rate increased in the region, or if we had 2 or 3 cases quickly come up on one of our campuses, that we may need to restrict some of the activities. And then when we're able to go a certain number of days with no positive cases, then we would resume activity. So it's a sliding scale.
Great. Okay, let's see. Kenneth Pinnell asks, mention was made of at-home CCRC by Goodwin House. Is there an organization or list of those facilities throughout the country for those who don't live in the Alexandria area?
Be glad to provide Mr. Pinnell with that information. And these are organizations that tend to be connected to a life plan community mothership, if you will, just as Goodwin House at Home is a service line offered by Goodwin House Incorporated. And if Mr. Pinnell wants to send me an email at lhutter, Hutter, at goodwinhouse.org, I am glad to introduce him to Karen Skeens, who's the executive director of Goodwin House at Home, and she can answer any questions he may have.
Great, and I just typed your email in the chat there for him and other folks. We got somebody that asks, you said everyone is on lockdown till when results come back. Do you mean the organization till the result comes, or just the people that tested positive?
So when we have a situation where maybe it's a staff member or a resident that we've tested, and now we're awaiting the results. As Dr. Gloria said, depending on the type of test, we may or may not move them out of the area that they're in the community. If they're in independent living, they would simply isolate in their apartment. If it's a staff member, they would go home and isolate at home. And so it varies based on the particular situation. We have never shut down the entire community because we've not had the volume of outbreaks across the community to warrant that. I will tell you that there is a return to work protocol for employees that have either been exposed or have tested positive.
Great. And Barbara Sullivan from Village to Village Network says, I really like the playbook and feel many of the guidelines would be useful to our villages, both locally and nationally. Can I share it? And yes, that is absolutely, that's why they're on. They want everybody to share it. Also, what programs are you continuing in person, and how are you combating the isolation factor at Goodwin House?
Yeah, it's a great question. And so what I would say is that we have implemented parts of our technology strategic plan pre-pandemic and brought in some systems like IN2L into our assisted living and memory care. And I want to say the number that I heard the other day was we have done over something like 2,500 healthcare Zooms with family members. Then there's a number for how many we've done in assisted living. So we've leveraged technology as one tool. It's really been extraordinary. We've also been able to do visitations outdoors with family members and their loved ones. We do require family members to be tested. And if it's for visiting a loved one in assisted living, memory care, or healthcare, the test needs to be within 10 days, negative result, 7 days. And if they're visiting a family member that's in independent living, it can be valid for up to 10 days. So we've been very strict as an organization and had a conservative approach about doing all we can to prevent the virus from coming into the community while still making it possible for residents to see their loved ones either through technology or in person. We also have our healthcare centers set up in a way that they're kind of in pods naturally. And that has enabled us to sustain some of the activities with our most vulnerable residents so they can be in a small group and be with each other for certain activities safely. Our independent living residents are able to move about the campuses freely. They're able to go outdoors and enjoy the green space and our courtyards and other areas. So there's been a fair amount of movement, and then we pivoted much of our program to be virtual. And we have a whole virtual calendar of programs, things that are streamed right into the internal TV channels for the communities. And I would also say that we have been very desirous of sharing what we've learned and our programming with older adults across the region. So we've actually done fitness programming, nutritious programming, gratis on the house for any older adults who would like to attend these webinars. Most of them are placed on our website, and you can go view it and all the resources that we've developed.
No, that's great. This is another really good question that came in that I almost feel like we could do a whole program around it. And just so you, Lindsay, so you know, we had a few people that voted on that said, yes, do a program on prepping for holiday gatherings. So let's get that on the calendar for hopefully the next couple of weeks before Thanksgiving. But this question is, what are you going to remember most when you reflect back on 2020 and the COVID pandemic?
I'm going to steal an answer from Lindsay because she's kind of, I steal Lindsay's wording all the time, by the way, everyone. I highly encourage it. She's kind of helped me frame things. I'm personally going to try and look back on the positive things. And so for me, again, this is a lot of Lindsay's thought, but it's how many different people have come together to help each other during this crisis. It's really incredible in the public sector, in the private sector, how everyone, I mean, you think about just the vaccine development alone, it's never been done, that a vaccine's been developed this fast before. It's, the most recent thing that's happened that's even been related was the Ebola vaccine, and that took 5 years. So everybody kind of pooling together, stronger together, sharing our resources, sharing our minds. That's the thing that I'm really going to take with me when I look back, to kind of see the positive side of things.
Oh, that's great.
Steve,
And yeah.
Steve, I'll answer that if I can by saying that I'm blessed to have had two parents that grew up during the Depression. My parents were born in 1925. Figure that one out. My dad served in World War II. My uncles all served in World War II. My father passed away last October, and I think of him every day because he said, leave the world a better place. That's what he taught his children. My mother is now a resident of Goodwin House, Alexandria. And I wrote someone last night, I said, my mother is very much a survivor, and she believes that courage is a better antidote than fear. And I'm proud to be part of an organization that's stepping into that and saying, how can we move through this as responsibly and as quickly as possible?
I love it. Great question, by the way, and a great way to kind of, for us to wind down this discussion. And whenever I say we're going to wind this down, inevitably a few hands go up or a question or two comes in, but let's try to wind this down. And Lindsay and Dr. Gloria, if you just kind of want to reiterate any sort of calls to action or anything that you'd like our audience to sort of do in relation to Goodwin. Oh, well, here's a question that I've got. You're working on version 2 of the playbook. When will that be out?
We're aiming for the second week of November. We're going to be adding a number of checklists to really make it easy. If this happens, here's your checklist. We've been perfecting and adding to our checklist. So middle of November.
I know the answer to this, but I assume, this is sort of turning into like a crowdsourcing thing by you sharing this, that you would like feedback from the organizations that are using your playbook, if there's things that are working, if there's things that they like added. Not that it's a guarantee that it's going to go in, because as you had mentioned, this is supposed to be absorbed and inspirational to a broad audience, but having that information can help it evolve.
Steve, absolutely. Call to action 1, please download the playbook. That guarantees that when we publish V2, you will be notified about V2. If you feel that there are enhancements that can be made, whether it's an amendment to what we have in the playbook or an addition, my goodness, please let us know. We don't believe that we have all the answers, but we want to share the answers that we have. So feel free to add to it. Number 3, share it with anyone that you think could benefit from it, and join this crowdsourcing effort. We're stronger together.
Awesome. Great. All right. Well, let's kind of wind things down here. What I'm going to share my screen and just kind of give you guys a glimpse at a few things that we've got on the calendar coming up. And I want to make sure that I don't miss, and you're getting a lot of thank yous there, but okay. So tomorrow we've got Who Gets What, How to Divide, Avoid Family Conflicts After We're Gone. This is going to feature some really cool technology, the Fair Split platform that helps families and individuals do that. So I think this is going to be a pretty interesting conversation tomorrow, guys, because talking about property and money in our families is taboo, and the way most of us have been brought up. And then let's see, next week we've got a panel discussion on how COVID-19 has changed senior services. Really psyched about this one, bridging the generations through meaningful connections with Big and Mini. On our ageism discussion, we learned about this program called Big and Mini that connects college kids with older adults. and we're going to get to meet the founders. And so that's going to be an awesome discussion. And then another discussion, this is moving into November, but I want to let you guys know about it. We got the founder of GoGo Grandparents. And if you guys don't know what GoGo Grandparents is, you know how getting rides on Uber and Lyft, it requires you be technically savvy enough to use your phone. GoGo Grandparents is an interface. So somebody without a smartphone can call the GoGo Grandparents number and they can get a Lyft or Uber ride, and they will coordinate with the driver so that if you're going to a doctor's appointment, you're not getting another driver to take you home. So some really cool programs, and we got a bunch more, including this holiday discussion that we're going to do with Goodwin House, I hope, because I think that'll be a really key one for before the holidays kick in. So with that, I want to thank you. And Sharon Parver says, thank you for all sharing the Goodwin House Playbook. This is an important resource for the field. We'll share the recording and contact info. Thank you, Lindsay and Dr. Gloria.
Absolutely our pleasure. Thank you, Steve.
All right, talk to you soon. Okay.
Thank you, Steve.
You bet.